Good afternoon, North Dakota. Thank you for tuning in. As always, we're grateful for your presence. Thanks for whether you're watching in real time or online later. We appreciate your focusing in on getting the facts and helping us guide our state. You're an important part of the solution. Today, we've got a number of things on our agenda, including an update that we'll have later on from our Chancellor of Higher Education, Mark Hagerott, our Chief Health Strategist for the state of North Dakota, Dr. Josh Wynne. They'll be speaking specifically on the North Dakota University System's plan for reopening campuses in the fall. And then we'll also have a brief update on the economic resiliency grant process. But before we jump into any numbers, I want to spend some time focusing a bit on the need for us to make sure that we're continuing here in North Dakota to do the things we need to do to not find ourselves in the position that other states are where they're having to roll back some of their reopening efforts. Because I know that we've said all along that we want to save lives and livelihoods, and the way we save livelihoods and the way we keep moving towards opening up is to keep the pandemic under control. The pandemic, as everyone knows from watching the national news, continues to spread around our country, and lots of travelers coming into North Dakota during this time of year. So maybe we have to be extra cautious here during this time frame, and as North Dakotans travel around the state, we've got areas of higher risk and lower risk, and so again, we want to make sure that when we have this the call for exercising personal responsibility. When we've done that in the past, the case numbers and positivity dropped, and we want to do that again because right now we are not headed in the direction we want to. We'll go through that with some of the graphs. But one thing to jump on right away which was reported this morning, it was reported that we had 160 positive cases. That would have been our highest daily total so far. 52 hospitalization, that was also our highest number to date. The 52 hospitalizations, that's accurate. That's how many people are in the hospital today. We have 864 active cases. That's accurate. Since 11 o'clock this morning when we released the data, that's the time every day when we release the data, we've come to understand that in the lab that we had a major batch failure that occurred on Monday. And so a bunch of tests that would have been reported on Monday were reported during the 24 hours on Tuesday. So I think the way we're looking at this and the way we'd like to share for the state when we're thinking about it in terms of policy decision making is that we're really combining Monday and Tuesday together as 2 days because we likely underreported cases on Monday Tuesday, we reported 82 cases from Monday. Today, we reported 160 from Tuesday because we report at 11 a.m. for the 24-hour period prior. The 82 that we reported yesterday was underreported relative to the test that came in and the retest run that was done after midnight. So again, if we look at those two together over those 2 days, 242 positives, just under 8,000 tests, 7,998. That's a 3% positive rate, and that would make it fits the trend line that we've seen, and we're not trying to make it fit. It's just that is the trend line, and so as we work back through the data, there'll likely be a restatement of those 2 days to get these in line. But for the purposes this afternoon, we should think about that we've got a 3% rate over the last 2 days on our point prevalent or our daily positivity rate. That still sends us in the wrong direction. That means we're still climbing because we were in the 1% range a couple weeks ago, and we're still climbing. So it's not the time for us to panic, but we need to say that we've got to really continue to be smart. We know that as we resumed and reopened, we created more transmissible moments, and whether those are weddings or sports events, whether it's bars and restaurants, hanging out on a sandbar on a beautiful day in the summertime. Whatever those events might be, we just need to be more cautious about transmissional moments. And so again, if we want to slow the spread, this virus only lives in people, and it jumps if it makes one person sick and they become contagious, and then they can transmit it to somebody else. So one way to not get this is to, again, keep a distance from other people. That's why we talk about the social distancing, because it has limited ability to travel and travels less well out outdoors than indoors. And so if you stay away from people and stay outdoors, avoid crowded indoor spaces, you lower the chance. So you can do your part in helping slow the spread by making sure that you're in a position, and if you can't social distance, you have an opportunity to wear a mask. There's 52 hospitalizations in the state, as I said. We have this morning talked to some of our large hospital leaders about their capacity and where they're at, and we have lots of additional capacity still in the state in terms of total beds and ICU beds, and so we're not at risk of hitting our limits there. But again, we like to see hospitalizations go down, not up. They've been going up, so again, just another piece of data for North Dakotans to take this seriously and make sure that we're being smart so that we're all doing our part to help support our businesses and help keep them open, help us get back doing the things we want to do in the days and weeks and months ahead. Some other things, our contact tracers, we want to share sort of generically the kinds of things contact tracers are coming up with so that people might understand what's going on in North Dakota. This is like listening to the local weather, not the national, but there was a entire cluster of college students who all ended up positive, who were on a party bus, that was rented. Again, and this is, again, I think we've seen from other states, alcohol gets involved, whether it's crowded bars or parties, and people forget the social distancing part of things. Wedding parties, a number of folks that have been where we've had contact tracing going back to wedding events, socializing around baseball, softball, other sports, college athletes that are training together. Those are all areas where we've seen clusters. We've also seen work-related cases. I spoke last week about the bank, but there's other offices, construction sites that are going on up in the oil field area, the energy sector, where we've had these clusters occur. And remember, again, this is not like the flu. This is something where you can be someone who's spreading it and not even have symptoms. And so again, the distancing and if you're not able to distance, wearing a mask are those things that can help slow the spread. But our goal remains unchanged, and which is that we want to save lives and livelihoods. And the way we do that is we test, we trace, we isolate, and then we preserve the hospital capacity so those individuals can be served at the highest level. We have seen a bit of a drop in the fatality rate. We hope that we don't see more deaths coming up following the higher hospitalization, because sometimes deaths could follow hospitalization. But in talking to our hospital leaders this morning, both in terms of therapeutics, how they deliver oxygen, the kind of care that's given is really improved in terms of our understanding. And so confident that if people get to a hospital in North Dakota, they're going to receive fantastic care that is going to help them make it through this challenging disease. And so again, for those that are out there, knowing for the 4 months we have not changed the goalposts. We're focused again on doing everything we can to save lives and livelihoods. We know the virus will spread, but if we slow it down, that's going to allow us to keep businesses open, help us get schools back open, and all the things that we want to be doing going ahead. So let's take a look again at our North Dakota SMART guidelines to maybe sum this all up, which again is pretty straightforward. These also haven't changed. Again, distances can be one of the first tools in your toolbox. It's free, doesn't require any. The government, can't mandate it. The government can't control it. The government can't police it. This is individuals just being smart about the distance that they are away from each other. Washing your hands frequently, because we know that this is a way that it can be transferred through hands and services. And then again, shaking hands, not a good idea if you've got any concerns about the situation that you're in. And then again, wearing masks when appropriate, and wearing masks when you can't socially distance. And then of course, try not to touch your face, because that's how it can get, if you got it from somebody else on your hands, you put it into yourself by touching your face, your nose, your eyes. So avoid doing that. And then of course, we know lots of businesses and schools and others have been working on disinfecting surfaces so that we can keep your customers and your staff healthy. So thanks for that. Let's jump into the last 7 days of testing. And again, I want to walk through these, but I've got a slide issue here where things aren't showing up, so I'll just look over my shoulder for a second. In the last 7 days, the 806 positive cases, and that's and we'll cover actives in a minute. We've had quite a few recoveries, but that's a increase in. We've had an increase in actives. We've had 32,000 tests completed in the last week, last 7-day period. I believe that's a record. And again, the positivity rate, dividing the 806 over the 32,356. 2.5% positivity rate. And then again, as I stated at the opening, over the last 2 days, that's crept up. When we combine the results of the last 2 days of the last 7, it's up to 3%, which is again heading the wrong direction. Cumulative on the right-hand side, that's the number of cases divided by the number of individuals in North Dakota, gives us our cumulative 3.9%. We're going to do a little more of a breakdown on this as we get further into the program. On the North Dakota testing from a serial testing point of view, still having the problem here, so I'll keep looking over my shoulder. We have tested, remarkably, conducted almost 271,000 tests in our state, and as we show going back over the last couple of weeks, going back to near the beginning of July, the bottom of that shows the new individuals that are tested. The top is the people that are repeat testing, and we'll talk again in a little bit about the importance of why we're testing people multiple times. Okay, on the and this takes it all the way back to beginning of May. Beginning of May was when we started showing graphs at these reports, breaking out the serial testing from the individual testing. As all of you know that are here and have been watching, we report this in every time we have a press conference, and this again shows the growing number. And this is also part of two things. One of it's part of us having the testing to be able to do surveillance testing. Some of it's testing vulnerable populations like people in residence in nursing home, and it's also about testing high-risk individuals, because if someone gets a test and they test negative, but you're a healthcare worker and you're working around people with COVID, and we test you again the next week and we test you the next week, each of those tests are valid. Each of those tests matter because that's related to the point prevalence on that day. Are we uncovering the spread of the virus in North Dakota? So any comprehensive and responsible testing strategy has to include serial testing. North Dakota is doing it as well as anyone, and so this is why we've been reporting it to everybody so people understand. Mathematically, if you carry that all the way forward, let's just say we get to the point where every single person in the state of North Dakota has been tested from a serial standpoint. If we can go back to the prior slide, if everybody's been tested once, and then we went out and tested people, and we came up with 10 positives, and they were all people who'd been tested before, and somehow the serial testing didn't count, I guess then that would mean we'd have 100%. If they were the last 10 people in the state that got tested, we'd have a 100% rate. So again, as we had in the very first slide, we've been reporting it both ways. We're reporting it cumulative as a percent of individuals, and we're reporting it in terms of the people that we took the tests of that in a day, and that any epidemiologist will tell you that that's the valid, appropriate way to be doing this. Going forward here, to the next slide. Again, on the active confirmed cases of 864, we got recovered 647. So you can see we've jumped by more than 200 active cases in the state. That's over the past week. That's the thing that does can start to put pressure on healthcare. This is the thing that can cause the outbreak to spread, because the more actives there are, if we don't find them and they're not isolating, then those can infect other people. So we are watching the active cases closely, as we are the hospitalized. Over the last week, sadly, the deaths are up 8 from 88 to 96. A woman in her 60s from Montreal County with underlying health conditions, a woman in her 80s from Morton County. Those underlying health conditions are still unknown. A man in his 30s from Benson County with underlying health conditions. A man in his 80s from Burley with underlying health conditions. A woman in her 70s from Williams County with underlying health conditions. And a woman in her 90s from Cass County with underlying health conditions. a man in his 70s from Burley with underlying health conditions, and another woman in her 90s from Cass County with underlying health conditions. And again, on behalf of Lieutenant Governor Brent Sanford and the First Lady and myself, we extend our condolences to all of those families who've lost someone in the past week who've passed away with COVID. In terms of our testing and active cases, this is a chart we put out on social media last week where we're tracking so people can see the daily test conducted is in the gray, the active cases in the gold. And so we did have a good downtrend, heading through the end of May and through the end of June, where active cases were trending down. That was fantastic. Testing was going up and cases were going down. That's what you want to have happen. That's why we kept having lower and lower positivity rates. Since the 4th of July time frame, or a little bit prior to that, we started to see an increase in active cases. And right now, active cases, the rise in active cases is outpacing our rise in testing. So you can explain a portion of the increase to the rise in actives because we're just finding more cases and doing a better job of testing. But you can't explain all of the rise because of more testing, because the slopes of those two lines are different, and clearly the active cases outpacing the testing, which then that shows up in our positivity rate. As we talked about, our positivity rate is going upwards. The rolling average, again, this is the 14-day rolling average. We've got the state of North Dakota in white, Cass County in blue, and Burley Morton in gold. And you can see here that when we go back to, this is May 21st, I think, is the first data point on this chart, but then it would have been 2 weeks of data prior to that. So each daily point on this chart reflects the average of the prior 14 days it would help, smooth the data and help us really understand the trend lines. We did a great job, the Red River Valley Task Force and the work in Cass County, bringing the Cass County numbers down to the state line. Burley, which was sort of on the early involved, then was really on the sidelines for a while in a positive way, is now coming up and tracking kind of neck and neck with Cass County. And we can see from June 30th to today where we've gone as a state from below 1% to about a little over 2%. And in our two most populous metro areas, the Burley Morton and the Cass County area, we've gone from under 2 to approaching 3, which I've talked about. This is a early warning sign where we have to continue to make sure that we're being smart about being the North Dakota SMART guidelines to make sure that we reduce transmission. Active cases by county. People have asked about this because we used to have this chart where there was a lot of white, which is counties with 0, but now currently we've got 46 counties out of 53 that have at least some activity, or at least one positive case, or these are active cases. But I think you can see in terms of the Burley Morton, Cass, Grand Forks, and then up in the oil patch area, the counties that we have up there extending from McKenzie, Williams, and Ward, where Minot is, that the vast majority of our cases are in our major metro areas, and including Stark, where there's 20 cases, Dickinson. I bring this up because, again, as North Dakotans, we say, if you're from a small rural area and you say, hey, we don't have an issue here, you might be right. But if you or your family are traveling to any one of our 8 larger metros, there's a more active cases. Maybe not more on a per capita basis, but there's just more active cases. And again, important for us for those active cases in those metro areas to be identified and for them to be isolating until they're past the transmission state, so that whoever's been identified as a positive and is active will not be part of the spread going forward. But again, this would caution people. Again, if you're in your hometown, maybe you're not wearing a mask, but if you come into one of the larger metro areas and you're shopping or doing things like that, you might consider it. This chart might also, as we continue to look at actives by county, may guide us as we think about school openings in the fall. And we know that there could be some cities or counties that may be looking at masks, how they want to approach masks on a local level. We'll leave that to some local decision making to be done at the time being. But again, if we want to keep our businesses open, the way we do that is we each do our part. And if you don't like to have large government subsidies to support economy that's faltering, one way to do that is help slow the spread, and the two almost is free. To just keep a distance. It's super cheap to wear a mask, and so these are again washing your hands effectively is free. So some of the three most important tools we have are all built into the whole individual responsibility category, not a government program category. Next up. We want to talk about patients that are currently hospitalized and show this on the trend. We've talked about the 52 already, but you can see when we had peaked earlier in the low 40s way back in May, we had a nice steady drop going all the way down to the 4th of July, and then we've had a fairly steep climb from under 20 to 52. This is a trend line that we want to pay attention to, and again, if you're someone who's young and healthy, but you potentially could be spreading, think about not just your own individual responsibility, but your social responsibility to help slow the spread, because you could be part of the reason why someone stays out of the hospital and stays out of these statistics if we can help slow it down. And this is important. The asymptomatic rate is 30 to 35%, so it's important for us to identify positive individuals early so we can investigate, do the contact tracing, and stop the spread. I think we're going next. Do we want to dive even a little deeper into this? We said we'd come down even further. North Dakota's testing strategy has been, again, unchanged. We want to identify early, not just symptomatics who are presenting, but we want to identify through the larger surveillance testing that we're doing, whether that's going to be college students in the fall, whether it's mass testing events we've been doing throughout this. We want to identify positive cases before they have a chance to spread. We want to identify who those positives have been in contact with, and then we want people to quarantine or isolate till they're past their point of being able to be infectious. What that means in terms of, again, on serial testing, which we talked about up front, is it's an essential part of any responsible and comprehensive testing strategy. And a key thing here, there's been some, I don't want to call it debate, but maybe some confusion, because different states are reporting differently. North Dakota has been in compliance all along, where we're reporting both serial testing and individuals test. We report the total tests and the individuals that are tested. But one negative test result does not make you immune to contracting COVID-19. If you're a healthcare worker working in a high-risk situation, then you need to be tested multiple times over the course of this pandemic to ensure that you haven't got it, to protect your family, and to make sure that you might not be spreading it to other people within those facilities. This case in point here, where we've had great success with this serial testing strategy, is in long-term care. We are now down to less than 10 residents across almost 10,000 people that are in long-term care, assisted living, and basic care in North Dakota that are positive today. But as of today, we've also have 24 healthcare workers in long-term care that we've identified, and identifying those healthcare workers and removing them from that environment, so that, because in many cases they might have been asymptomatic or non-symptomatic, they could be the spreaders that could be really affecting a vulnerable population. So this is an area where serial testing has really worked. Again, talking to the hospital leaders this morning, many of them are moving to a testing strategy where people are tested before they're admitted to the hospital for any reason. If you're coming in for cancer, for heart care, for stroke, they're doing a test. Those individuals may have gone through a mass testing or surveillance test earlier, and now they're getting tested again. But if they found out if they had COVID at that moment, that would be an important, valid test to protect everybody in the hospital. So again, it's responsible, it's comprehensive, it's strategic, and it's important, because again, the PCR tests that we're doing, which is the polymerase tests that are the viral tests, these are a point in time. You can be negative last week and positive this week, and so it's important that we take a look at that. That's why we're reporting the numbers both ways. And the last point on that slide, again, was that we do report these each day, total tests that are conducted, as well as the unique individuals. That's on the daily report that comes out at 11 o'clock in the morning. Next slide is, again, on understanding rates, because I buzzed through these quickly, but this is a slide we use at the beginning of each program. The daily positivity rate, this is for today, the 160, which is, as I said, overstated, but we're using this as an example. We divide that by the number of total tests reported to get that daily positive rate, the 3.8. On the other side of the chart, these are not the same. That's the cumulative divided by the unique North Dakotans that are tested, the 139,000, to give us our cumulative rate. And this shows us, of the people in North Dakota, individuals that we've tested, how many of them have turned out to have it. And that's the accurate number to be thinking about on the 3.9%. So again, daily positivity, that's a snapshot in time. Got the word point prevalence, because for those that are epidemiologists, that's the definition of what that means. And then on the right side, it's cumulative. It's the sum total cases among individual North Dakotans who've been tested. And next is the daily cases that we have each day. In this case, which represents a chunk of Monday's tests and Tuesday's tests got rolled into this 160 number. All of those get rolled over to the cumulative, to the positive. So the total cumulative positive is always going to go up and up and up, because it never goes down, because we're just adding more to it. So every day we can say we've got more cumulative. That's why it's important for us to focus on active, not cumulative. The unique and serial tests, the 4259 that we reported today, either someone who's been tested never before in their lives, or someone who's been tested several times in their lives, like a high-risk healthcare worker, if that produces a positive case, that's what tells us as policy decision makers whether or not we've got a point prevalence of the disease in the state of North Dakota. So we have to include the serial tests in the denominator for our daily positivity rate. Now, for the cumulative rate, which we've always been reporting, we don't count the serial tests. We only count unique individuals. If we were, some might have suggested that we're trying to deflate the numbers. If we wanted to deflate the numbers, we would divide cumulative by the total tests conducted, the 270,000 tests we've done. That would produce a number of 1.9. That's what we're not doing. So again, we are stating absolutely correctly that there have been 5,367 positive cases, 139,266 unique individuals. That gives us the cumulative 3.9, but it's important also for us to know, and as I said, again on this example, our daily positivity rate over the last 2 days is really 3.0 because of that overload from one bunch of tests moving from one day to the other. The positivity rate and then the positivity rate cumulative, these happen to be close to each other, but they're two different numerators, two different denominators. And going to the next slide again, here where we talked about this on the point prevalence rate. Again, this is the thing we want to pay attention to. It will continue, and to avoid challenges of tests maybe flowing on one side of midnight or other in terms of when they get reported. That's why we look at that 14-day rolling average. Uses a better sense, and that's, as I said, when we've gone from as a state, below 1 to over 2, and we've gone in some of our key counties from below 2 to almost 3. That's a trend line that we're paying attention to for us. But again, in context, where we're at with those kinds of numbers, New York again, and New Jersey and others, when they were in the key part of their crisis, they were reporting positivity point prevalence rates in the 40% rate plus. In terms of next topic I think we want to get to is masks that we're moving to next. And again, when we've got an increase in cases for concern, one of the things that's been a big national discussion is about masks and mask mandates, et cetera. We today want to remain consistent, which we've always said, which is this is probably one of the most impossible things to try to mandate from a government standpoint. We've got guidelines that have suggested it. We still suggest that in businesses like personal care businesses, where you've got tattoo or massage therapy or the hair salons, nail salons, where people are in close proximity to each other for an extended period of time, more than 15 minutes, those are great places to wear masks, and particularly if you're a worker in that area and you want to keep your business going and you've got a series of customers that might be coming in over the course of a day, whether it's 10 or 20 or 30 people that you might be seeing. Really good idea, because you don't know who's walking through the door, to be wearing a mask. Business owners, I would think that one of your number one goals as a business owner, and the biggest asset in any business we have today is your team members, your employees, and to protect your team members, having a mask policy within an individual business. We're seeing this happen across the country, whether it's large national chains or whether it's people that operate big boxes here in North Dakota, like a Menards or Hornbacher's grocery store. Very sensible to protect the people that work there, and very sensible for customers going into these environments to think about wearing a mask, and it's something to do. But there are other states that have gone with the statewide mandate. We're not doing that today. I think there's issues about how do you enforce it, how do you make exceptions for those that, some people aren't able to wear a mask because of medical conditions, people that may have certain breathing or oxygen challenges. That creates a problem for them. So whether it's a one-size-fits-all approach, I don't think so. And we've got very low counts, as we've talked about. The trend line's not going the right way. But one way that if people want to be active and out and about, but still playing their part, when you're active and out and about, if you're in places, whether it's a gas station, a grocery store, or some other kind of place, if you wear a mask, then you're doing your part. As the president said last week, it's a patriotic thing to do because it will help get our economy going again. So with the one thing that I would want to say on this one in terms of wearing a mask, what do you say to someone who's wearing a mask? I think I said this on statewide radio last Friday. There's one thing to say to someone wearing a mask. That's thank you. It's thank you, because they're doing their part to help protect others. The Grand Forks Herald website today, there's a letter to the editor about a dad. Someone was driving by his 14-year-old son wearing a mask, and the person that drove by him, apparently is reported by this letter to the editor, yelled obscenities at him. That's the opposite of saying thank you. Guess what the son had just done? The son had just left his grandparents' backyard. Vulnerable adults that he was going to visit outdoors with social distancing and wearing a mask because he cares and loves about his grandparents. We should be thanking that teenager and everyone who's wearing a mask, because they're not only protecting themselves, but everybody else that's around them. And we've talked before that one of the tools that we have to fight this is empathy. Empathy is about trying to put yourself in someone else's shoes, and whether you're a parent that's got a child who has a cystic fibrosis, or if you've got a friend that's got a organ transplant, someone who's going through dialysis. These are all people that you may not know that person has an organ transplant. You may not know that they regularly get dialysis. They may look fine to you, but they're highly vulnerable to this disease. And so again, North Dakota, let's dial up our empathy. Let's dial up our understanding. Let's dial up our gratitude to those people that are wearing masks. And if we can do that, we can stay away, keep a light touch of government and avoid that. And again, prove to the nation and the world that we can get through this with both individual and collective responsibility. Why we talk about wearing masks? We haven't shared this data. There's so much data out there. I mean, there's a lot of people that say masks don't work, but let's take a look at 2 slides. Masks do make a difference. If you are 3 feet away, and somebody coughs, sneezes travel faster than coughs, 3 feet in 2.3 seconds. So the standard distance that we used to sit in conversation when you're in a large crowd would probably be at 3 feet or under. And we just have to understand that that's a riskier area. 6 feet, if somebody coughs, you might have time to sort of back up and say, the person says, excuse me. Of course, this is why we've said pre-pandemic, we always told people, during flu season, cover your cough, cough into your elbow, not into your hand. These were things that were, these things existed in public health pre-pandemic because this is the same way you might give someone the flu. 12 feet in 53 seconds, we say 6 feet, but this is all when someone not wearing a mask. How about if you're wearing a mask? What happens? Because again, you can find all kinds of stuff. Masks don't work, particles are too small, they can go through even the very best masks. If it's not a best mask, hey, it's a very practical thing. If you've ever seen somebody sneeze, you don't need to have the laser light photos on this. I mean, watch somebody watch somebody give a speech on a TEDx video who's talking on stage. You can actually see the particles if the light's bright enough coming out of their mouths. And so again, you can get leakage from the top, you can get leakage from through the mask, you can leakage from the bottom. This is a homemade mask stitched with 2 layers of cotton quilting. But guess what? The masked air particles travel just 3% the distance compared to the uncovered cough. And so, again, any kind of face covering is a plus. And so once we get into thanking people for wearing masks, we can thank them for wearing any kind of mask. Whatever logo, whatever quality, homemade, not homemade, whatever it is. And of course, if you're someone who is working in healthcare, that's why we've done all the efforts around PPE and supplies, because those people that are literally in the face and working to support those who are COVID positive, we want to make sure that they've got all the best, whether it's eye shields, N95 masks, things that can help protect them. So that's what we're saying on masks. And again, I know I'm sure there'll be a hue and cry for North Dakota to do a statewide mandate. Again, we want to put this back out to businesses in particular to protect your employees. Our schools are going to get to make that decision at the local school district about whether they're in a high-risk county or not high-risk county, the role that masks play, and you'll hear from higher education that they're debating that same topic. But let's stop. We can debate on who does it and who makes the decision, but let's end the debate about whether or not it's a positive thing or not, because if it doesn't affect you if somebody else wears a mask, it actually helps you if somebody else wears a mask. So if you're someone that can't wear a mask for whatever reason, I would just join in the chorus of thanking people that are and having the empathy to understand that they may have a reason, a family member, a child, someone else that they're close working conditions at work, something where they may have to do that. And again, better than much less expensive than more big government bailouts. Okay, with that, we're going to move to higher education. Is the next topic, and we are really pleased to have Chancellor Hagerott here. Dr. Wynne's going to join us by video to give us an update on reopening college campuses and the university's system plan for the fall. And I want to say Dr. Wynne is wearing 2 hats. He is serving half-time as the Chief Health Strategist for the state of North Dakota as we're working on a long-term plan for health strategy. But he was also appointed by Chancellor Hagerott to lead the effort about across all of our 11 state universities in terms of how we're going to safely reopen our college campuses in the fall. So again, we want to welcome Chancellor Hagerott. Thank you for being here.
With your permission, sir, I'll take my mask off. So, well, thank you, Governor, for giving us this opportunity. And I just want to tell the viewers we are fortunate to have a governor like this, National Guard like we have, Department of Health. I speak with lots of chancellors and system presidents, and there's a lot of states that are locked in real arguments and discussions. Our legislature's been very supportive, so we have a great foundation on which to return to campus in the fall. And make no mistake, one of our top priorities is the health and safety of the students, the faculty, the staff, the communities, but it's not the only priority. The university system, and this is being confirmed across the country, is a state asset that helps to create the next generation of medical workers, lab techs, nurses and doctors. It's helping to integrate, displaced workers, unemployed, diversify our economy, the mental health of young people. So we have a mission just like EMTs, grocery clerks, the people that keep the lights on at the power plants, that we've got to bring us back. And I can say this, that one of the major themes across the country is how to de-densify the campuses, and we're blessed to be in one of the most rural states. So we're very confident that we can move forward here in about a month. 24 August is when the students would be restarting classes. I don't know how many students pipe in live. They may look at this later, but we're really excited to have you teaming with us, just like you did in the spring. North Dakota seamlessly shifted students off the campus, and there were states where there were real disturbances. Even local police had to help move students off. That didn't happen here. We didn't have a single case on a campus of disturbance and disruption, and we're counting on the same cooperation coming forward. And so that's all about some of the things the governor mentioned, and we'll get in, and I'll turn it over to Josh Wynne in a minute, Dr. Wynne. But it's all about getting that R factor down, which is washing your hands, social distancing, wearing masks, contact tracing, serial testing, but also with the help of the governor and the Department of Health and a man named Vern Dosh, we have an incredible partnership on how to pre-screen thousands of students that will be coming back to campus. All of these are like in a war of attrition to just keep knocking this down. I was talking to my one of my former students who said, you should appeal to the gamers out there, that we are in a real life battle, a competition to get the R factor down, and all the students play a role in that, of reduce that transmission rate by, the mask policy and other things that the board will be talking about. So what has the system and the state board done to try to help the students and the faculty and staff on the front line? Because make no mistake, each campus is in many ways independent here because of the great distances involved. Literally it's hundreds and hundreds of miles from Williston to Fargo. So they have the benefits that if we would have, and there will be obviously infections, right? We know this, just like in any war, there's casualties, but we're blessed that young people are generally able to navigate this. But we're recognized, the faculty, staff, presidents, and students at Williston will have our support, the National Guard support, the governor's support, but they are the front line. But we took the benefits of the system and convened a task force, which the governor talked about, at 3 tiers: small colleges, medium size, and large colleges, led by Dr. Darling for the smaller campuses, Dr. Shirley, the mid-tier, and Mike Bohr and Eric Plummer for the big campuses. Dr. Wynne is leading that, advised by a couple other key people, Dr. Carson, which you've heard his name before, and Dr. Ryan on the state board. So we've got a task force sharing best practices. I just got off the phone. In fact, they may be still talking now of the cabinet was convened to go over some new policies the board will address tomorrow about the testing strategies and also the mask policy, again, to get the R factor down. Again, for the gamers, call it the COVID conquest, whatever you want to call it, but we are in a real life conquest to beat this thing, okay? So, Dr. Wynne, I just want to make sure, are you out there?
Yes, sir, I'm right here.
The voice. Okay. So at this point, I would just turn it over to Dr. Wynne to talk about some of the practical things that students can do, but also what they've been doing about the testing. Maybe you could talk about the many, many sites that you're going to try to cover and some of the more details. And I'm glad to chime in to help you, Dr. Wynne, if needed. So I'll be right here.
Okay, well, thank you, Chancellor. Thank you, Governor. It's a pleasure to be with you. The Chancellor asked me to head up this task force, and basically the task force was charged with the following challenge, and that was, number one, to see how we could get students back to campus for the fall semester, and number two, to do that as safely as possible. We know from talking to students that they really do enjoy the campus experience and look forward to it. And while the university system made a very successful switch to online education during this COVID crisis, students really enjoy the mentoring of being with their professors and the comradeship of being with colleagues on campus. So we were charged with trying to facilitate that process, but in the safest way possible. So what we did was we looked at the policies, practices, and procedures throughout the university system so that we could bring them together so that all 11 institutions could profit from the efforts of each individual institution. An important part of this, as the Chancellor mentioned, is a testing strategy. So why do we need to do widespread testing, especially of students, but also faculty and staff? Well, one of the prime reasons is our students will be returning to campus from near and far. So at UND, for example, we don't have students coming just from the Grand Forks region, but also beyond that. And with all of these students coming together and then living in close proximity to each other, that is actually a perfect recipe for the transmission of the disease. So what do we do to try to prevent that? Well, we do all of the common sense things that the governor and the chancellor talked about: the physical distancing, the wearing of masks, the frequent hand washing, etc. But also, it's critically important to try to identify and then isolate any student or faculty or staff who tests positive for the disease. Why is testing so important? Well, roughly 40% of people may be able to transmit the COVID virus and yet have no symptoms whatsoever. So we can check their temperature and the temperature will be normal. And we talk to them and they won't have symptoms, and yet they can get their neighbors, friends, colleagues, teachers sick by transmitting the disease. So if you don't know that you have the disease, the only way of identifying it is through testing. So through the leadership of the North Dakota Department of Health, there will be widespread testing throughout the state of North Dakota in the days leading up to the opening of the campuses the third week in August. And we are encouraging all students, along with faculty and staff, to engage in this testing. It has run very smoothly throughout the state, and we think the students, along with faculty and staff, will find it to be a relatively easy process. And the important thing, again, is not only are you doing something for yourself, more importantly, you're doing something for your fellow students, for your teachers, and for the community. So I like the term that the governor uses for this, the smart restart. Yes, we need to restart. We need to bring students, faculty, and staff back to campus, but we need to do it in a smart way so that we don't endanger each other. As was emphasized, the reason to wear a mask in appropriate situations is not to protect yourself as much as it is to protect the community. So please, I would entreat you, if you see someone wearing a mask, the proper response is thank you, because that person is thinking not about their health, they're thinking about your health. So with the policies that are being recommended and will be instituted throughout the university system, we are looking forward to welcoming our students back to campus, but welcoming them back to a campus that is as safe as it possibly can be, given the reality of the COVID situation. And we really look forward to having our students really involved in this process, because they are, after all, the best ambassadors for this smart restart policy. So thank you, Chancellor. Thank you, Governor, for asking me to make a few comments.
Thank you. So the one last thing I wanted to say, and then turn it over to the governor, is I want to thank the governor and the legislature, because they appropriated millions of dollars, $44 million, to clean the campuses again, knock the R factor down. We're looking at ventilation systems, but also something the governor has been on for probably his whole life, use the benefits of distance technology. So every class, hopefully across the entire system, will be rigged with advanced technology, so we'll be able to do what's called the hybrid flexible presentation. If somebody gets sick, they go back to their dorm, maybe they go back home, but they can still take the classes real time, what's called synchronous, and that wouldn't have been possible without your support, Governor. So that's the second thing we're doing to try to help reduce that transmission. Sir, turn it back over to you, unless there's something else. Do you want me to stay up here, or? Okay.
So we got a little more. Stick around until we get to questions. But I want to make one thank you, Chancellor, and thank you, Dr. Wynne. One clarifying comment on the $44 million that was discussed was those were federal coronavirus relief funds, and those were the dollars that each state had an opportunity, and that would be through the Emergency Commission, the budget section, that those dollars were allocated. But that was the part of the $1.25 million that each state had at a minimum amount, and those were dollars that had to be expended on things that weren't in the budget prior, had to be expended between March 30th and December 30th. And so putting those dollars into higher education, a restart was a qualifying element. Happy to support that as we get those students back to North Dakota and back in school. The Next, we want to give a quick update on economic resiliency programs update. This is the economic resiliency grants. These also came from that same bucket of money, the coronavirus relief funds, and the economic resiliency grants, or the ERG. These were programs being led by the North Dakota Department of Commerce, also came through the same mechanism through the Emergency Commission with support of the legislature via their budget section. Provides grant funds to companies operating in North Dakota for business improvements to help restore consumer confidence in the marketplace and reduce the spread of COVID-19. Businesses can apply for grant funding up to $50,000. If you're a business, up to $100,000 for businesses that have more than one location. And these are direct investments to reduce the COVID-19 spread. And that would, again, these are grants, not loans. Investments could include things like reduce repetitive touch, so touchless payment, automatically faucets, door kicks, tech to help you manage takeout and drive-through orders, so it could be software related. Those that create distance between customers and employees, which a number of people have expanded their outdoor dining. We know a number of communities and cities have relaxed some of their regulations around sidewalk dining and others. We encourage that, and also partitions for indoor, and then things that might improve infection control, whether that's PPE or UV sanitizers, temperature checking equipment, other things that you might be doing within those businesses. But again, restoring consumer confidence so that people of all ages and all risk levels could feel like, hey, it's safe to come back in. And again, applications for the first round of these ERG applications will open soon. They're going to be processed on a first-come, first-served basis. Make sure to get your application in early. The deadline is August 17th. I wouldn't wait till then. I would, again, when they open up very soon, I'd be on top of that. The funds, once approved, will be distributed by September 25th. If any funds remain, a second application round may be announced. But if you want more information, it's at ndresponse.gov under COVID-19 Business and Employer Resources. And again, thanks to the team members in Commerce Department who worked hard to create this brand new program. It would typically, a new program like this with software and websites and everything might take 4 months or 6 months to implement. These folks have been working around the clock. They've got it. They're going to have this thing up and going in just 30 days. So thanks to the legislature, thanks to the Commerce Department, thanks for everybody that's worked to help get these ERG grants out to North Dakota businesses. And again, that applies to tribal businesses. It applies to small businesses, large businesses. If you're a business in North Dakota, check that out under ndresponse.gov. Behavioral health update, which we include every day. Many North Dakotans have returned to daily routines, but there are other individuals considered high risk who continue to be distanced from loved ones and daily activities. And there are many factors that can put you in a high risk category. It could be age, could be your body weight index, immune deficiencies, circulatory issues, diabetic, cardiac, respiratory, organ transplant, people that have dealt with cancer, recovering from cancer, people who've recently had chemo or radiation. These are all folks that might fall into the high-risk category. As we've said before, this could represent 1 in 5 North Dakotans. 20% of North Dakotans may fall into this, into at least one of these high-risk categories. categories if we're including age as part of that. The Behavioral Health Division has developed a new resource for high-risk individuals with advice on how to handle the stress and how to stay safe. Again, visit behavioralhealth.nd.gov for more information. Ideas that are in there include focus on what you enjoy doing, checking out 7 things that are now free because of COVID-19, or finding a way to connect with a person but at a safe distance. Supporting your mental health is just as important as your physical health, and if you feel a need to reach out or want to talk to someone, I want to remind anybody, whether you're a high-risk individual or not, we got free and confidential crisis counseling services, and that could be whether it's mental health, financial, whatever your concern. Visit projectrenew.nd.gov or call 701-223-1510, and free and confidential trained counselors will be there to listen to you. On the good news section, well, we're busy battling the pandemic and having these press briefings. Government continues to charge forward on many different fronts, and I want to thank the hardworking members of the state of North Dakota, Team ND, but also at the county level, the city level. Government continues to move forward just like every other industry, working to make sure that we continue to do the work for the citizens of North Dakota. And one of the things that we're working hard to do in one of our biggest industries in the state, which is K-12 education, if you think about how that touches 120,000 students, over 15,000 or more staff and administrators and instructors that work in that area, and then if you throw in higher ed, that's another 45,000 students plus another, say, thousands more that are in faculty, and then each one of those individuals has a family. Pretty soon you're up to close to half of North Dakotans are either directly involved or 1 degree of separation away from somebody who's working in the education field. And yesterday we had a record. We had our first both blended, was in-person and broadcast, Governor's Summit on Innovative Education, 4th annual. We had 1,300 individuals registered. That's 2.5 times more than any previous conference. So again, there are some silver linings where by working hard to deliver great virtual content, you can actually expand your audiences. So we're so grateful to the teachers, the professional support staff, the paraprofessionals, administrators, parents, students, school board members, elected officials, mental health professionals, work councils, business and community leaders, and a number of key legislators who lead education. We're either there in person or dialing in online. We want to thank all of them for their critical work. We had a fantastic set of national leaders. Again, this is one of the benefits when people that might not have the time to fly to North Dakota, and we may not have, in some cases, have the budget to get professional speakers, but we got in 4 incredible speakers yesterday. I know for sure 3 of them spoke for free. They all work on .org related nonprofits that help this, but Sal Khan from the Khan Academy, Dean Kamen, and who invented the Segway and is with First Robotics, Scott McNeely, founder of Kurawiki, and George Kuros, who is a nationally noted author and leader on education, all delivered interactive messages yesterday, which was fantastic. And then we had more than 20 locally led breakout sessions that occurred during the day. But the presenters and session leaders shared an incredible amount of learning, challenging us all to have not just a growth mindset, but an innovator's mindset on how do you take these new tools and technologies to give teachers back their time to address, how we deliver great CTE, how we deliver a STEM as a team sport, and how we think about the new generation of education that can occur. It was truly an inspiring day, and again, grateful to everybody that was there. The key thing also now, because we've got the video content, the videos from the summit will be shared for all attendees and all North Dakotans, and they'll be broken down into the individual, both breakout and keynotes, and so that's a great opportunity to learn more. If there's any of those speakers that you want to learn more about, there'll be links available, I'm sure, both on the DPI and the governor's homepage in terms of how to get follow-up information from that conference. Closing with a note of gratitude for the day, quote from author Roy Bennett. Sometimes even the simplest act of gratitude can change someone's entire day. Take the time to recognize and value the people around you and appreciate those that make a difference in your life. And I would turn this gratitude moment, the simplest act of gratitude can change someone's entire day. Think of that 14-year-old boy, if someone had said thank you to him versus the opposite. See if you can make someone's day by telling them thank you for wearing a mask. And from that, we'll say we'll be back here next Tuesday at 3:30. Until then, if you're signing off before what I'm sure will be a fun and lively Q&A, be North Dakota smart and follow the guidelines and stay healthy and stay smart. Thank you, North Dakotans. And now we'll stand for questions. And I should note that we, in addition to myself, we've got the Chancellor here, and I believe Josh Wynne is going to be available also online for Q&A. We're going to go first to online for a switch, and then back to the live audience.
Mike Smith with 660 KUIZ in Williston. When we began the reopening phase, you said we could take more risks. Are we still in an acceptable level of risk according to your data? And if so, what is the threshold that pushes us into tighter restrictions?
Well, I'd say we have taken on more risk in terms of the guidelines that we've offered, but some of the examples I gave from the contact tracing, there are some people that I would have to say are not necessarily following the guidelines. If we've got a large event where people are in close contact with each other, that would not be sort of following a North Dakota SMART guidelines. So I think we've taken on the risk. We're seeing the result of that. We're seeing a slight increase in the positivity rate. We're seeing this disturbing trend and increase in hospitalization. We're seeing an increase in the number of actives. So I think it's just a good, early warning sign for North Dakotans to say we've got to take this thing seriously, that it's still here, it's still contagious, and we have to follow the basics on how to make it not spread. So we're starting, with today, with, again, trying to really encourage people to exercise that individual and collective and social responsibility to make sure we can start turning those numbers the other way. And as far as, if part of the question is, when we get back into school, we'll certainly, I'm sure school boards will be looking at the data in the counties. I think the number, Mike, you've got the number there. Do we have 24? We have 24 counties in the state that have less than 10 active cases. You saw in there, and some of those are 1 or 0 of those 24 counties. And so we've got a lot of places where we're in great shape. We have other places in some of the metro areas where there probably is more transmissible moments where the numbers are going up. And so that's why we're seeing different levels of risk. And that's also a challenge, because if you take a look, we do have long-term care distributed across the state. Long-term care also tends to be concentrated in the areas where of higher population in our large metro areas, because that's where they can get staff. They're closer maybe to where their kids are living now. And so when we've got, again, we're fighting to keep this out of and away from the people that are most vulnerable. And so again, I'd say today is a day of a word of caution for everybody to not feel like we're over this or through it. But whether we have to roll back or not depends on what people do, not what government says. And I'm hoping that the people of North Dakota will do things that will help us continue to move towards opening as opposed to going the other way. We're going to go to Lane next, and we'll come to the left side of the room.
Governor, earlier you talked a little bit about the math that goes into finding the positive rate. Other states and other organizations like Johns Hopkins University, they do it a little bit differently. They do the unique positives divided by the unique tests. Why does North Dakota do it differently, and does that kind of give a confusing message to people?
Well, let me be clear first about the, as we've researched this a lot recently, it appears to be from the Johns Hopkins website, which of course is a well-respected brand in medicine, that they're using the data from a group called the COVID Tracking Project. The COVID Tracking Project is sponsored by a magazine, The Atlantic. This is not a government-sourced thing. So I would take a look and say, okay, if you're getting your information from a non-government source to make these predictions, that causes me some concern. We went back and pulled all the data from the beginning that the COVID tracking project, the Atlantic Magazine COVID tracking project, was using from North Dakota, and we're going to pour through all of that to try to understand what, when they were pulling it, what they were pulling it. It's interesting. They're suggesting that there's things there that we're not reporting that we've been reporting from the beginning. So I think there's some data gaps, data translation, data issues between the COVID tracking project and the state of North Dakota, because between our office and the health website, others have said that we've had some of the best information, the best graphs, and the most timely information. We're doing it both ways. When you look at the footnote under Johns Hopkins, it says that states should report the number of individuals that are tested and the number of total tests, and we've been doing that for all along. And so if there's additional information, we walked through all the block and tackling today, but if there's things that we can do with the numbers that we have to make them more clear to everybody, we'll do that. But I guess I would say I disagree with the COVID tracking project from the idea that every time we test someone, because it's a point prevalence, it doesn't matter if we tested them last May. If they thought they had symptoms last May and got tested and they were negative, turned out they had a cold, they walk in the door and they get tested today and they're positive, then we can't count them in the denominator because we tested them once before, so we count them in the numerator but not in the denominator. If you were doing that in math class, I don't think you'd get a very high grade. I mean, so it's like if you're gonna understand the point prevalence, which is what all of our epidemiologists, whether it's Dr. Carson at NDSU or others, have all reviewed the way we're doing it. They all say this is the most responsible, the most transparent way to do this is to make sure that when we're giving the daily rate, that we're taking every test we take today, because it doesn't matter if we tested them 2 weeks ago or 2 months ago. If they've got it today, they need to be counted in that denominator and the numerator. That's the point prevalence. That's the daily positivity rate. Cumulative rate, we agree. If we were counting every test that we'd made and trying to throw it in to artificially lower our number below 3.8, if we were trying to get it down to 1.9, what it is, because somehow we thought we would be advantaged that way, but that's not anything we've ever done. It's not anything we would ever consider. We want to make sure that North Dakotans have all the information they need about the tests that we're doing so that they can make smart decisions for themselves. And we're going to continue to fight for transparency and make sure we get all the numbers out there. So I guess I disagree with this idea that serial testing shouldn't be counted. And again, when we dug into that list we've used before of here's the top 10 in terms of testing per capita, I think there's a number of states above us that are including in their percent of per capita tested, they're counting people that they've tested twice. Rhode Island was #1. Now they're down below us because Rhode Island started counting it the way we did. If everybody else started doing it the more conservative way the Rhode Island and North Dakota is doing, Rhode Island and North Dakota would probably be #1 and #2 on that chart again. But there's all kinds of issues with Washington D.C. data because they're including data from Virginia and Maryland in their data. So you just got to throw that one out completely. The District of Columbia data, and you look at the state data, but different states are reporting it different ways. We think we're doing it accurately, completely, transparently, and again, in the most effective way for anyone to make policy decisions. We'll go Jeremy and then Jack.
So I guess the way that Johns Hopkins reports positivity rate is based on a 7-day rolling average using only counts of unique individuals tested, as Lane mentioned. Why not provide that number in addition to the positivity rate that is provided on a daily basis, counting all of the tests taken?
Well, again, you're saying Johns Hopkins. COVID tracking project run by the Atlantic is the one that is producing that number. And if you take a shorter set of days, like 7 days versus 14, we've been doing 14 all along. We did 14 because it made sense. That's what the isolation rate was, right, for us to kind of match the course of this disease. If you were going to try to have, in the politics of data, if you're going to try to have a state that previously was very high, take any of those in the New York metro area that was high and you want them to look better, you would use the shortest possible rolling average. If rates are trending down, then you'd have a shorter date. I'm not suggesting anything. That's just a math observation. Again, we're more conservative by using the 14-day rolling average. If somebody wants to take a look at the 7-day, I can tell you what the answer would be. If we had 7-day, it would have showed us looking better when things were dropping, and it would show us slightly worse now because it favors whatever direction or disfavors whichever direction you're going because it's not as long of a spread. But I don't have any reason why we couldn't show that number. From a policy standpoint, I'm going to keep looking at the 14-day because I think that gives us a better sense or a better trend. But again, Johns Hopkins is using the COVID tracking data. I think there's state-by-state comparison issues in the way that data has been being compiled. I mean, in a quick look at it, there was some data from North Dakota that wasn't accurate in there. So we're going to get directly with the Atlantic and make sure that make sure we understand what data they're pulling from North Dakota.
Just to follow up, that 14-day figure, where is that reported on a regular basis?
Well, it's reported here, and if that's something we need to post every day, if we're not posting that every day, I thought we were, but. Okay, well, thanks for pointing that out, Jeremy. I'll check on that, but it's there's not, again, the data is all there, and I suppose somebody could compute it. Someone could easily compute it off of what we put out every day at 11 o'clock. But if we can do the math and maybe we can include that on the daily report every day. Easy enough. Jack.
Could you provide an update on possibly establishing a COVID-19 task force in Burley and Morton counties? And I think you already addressed this, but what walking back of any reopening there might be just based on the recent records and hospitalizations, new cases, et cetera?
Yeah, there's two questions there. The Bismarck-Morton Task Force, we're still right now planning on continuing to do it without quota task force. We had as we called it, the Red River Valley Task Force, there were some additional challenges because we were dealing with another state and a county that was across the way. There was I think I've shared before, the first time there was testing in long-term care in Clay County was on May 23rd, a couple months into this. So really getting the coordination across that metro area. We think even though we've got two public health areas here, there's public health that serves about 5 counties, including Morton going west, and we've got the Burley, Bismarck, public health here. We think the coordination is strong here, and again, it's really one healthcare system. We've got the hospitals are on the Burley County side of that thing. We think there's good coordination, so I think we can keep managing it here. If it continues to go the wrong way, then maybe you'd try to drive more attention to it. But in some ways, it's also been easier because our state lab is here. Again, on the calls this morning, Dr. LeBeau from Sanford Bismarck was online. They've been doing a lot of testing. Sanford directly point of care on all the admits that are coming in, but they've also been working closely with the lab. So I feel we've got good coordination here and between the stuff that we're doing at the state level, like the big drive-through stuff at the Capitol, but then we've had static testing available through Bismarck Public Health that they're doing down at the Bismarck Civic Center. So I feel like we got a little less complicated challenge because we don't have 2 states. So that's what we're doing here. And then your second part of your question was on where we would change the status. I'd say we're in this green zone on our Roy G. Biv color spectrum, and the next where we would go to is blue, being the most open. But we're in solid green right now, and we are not, fortunately, not going backwards yet. But we're not, right, as I pointed at the very beginning, we're not headed towards let's open up completely and everything's behind us, because the numbers, both hospitalization and positivity rate, are trending the wrong way. So we're still in the green zone in my mind, where we're at with the just under the 3%.
What would change our color code, going blue or red?
Well, we gave ourselves, when we created those guidelines, we gave ourselves the opportunity to issue different different status by county. And if we continue to see trends where this thing really consolidates around metro areas, then you might start working with county officials and city officials and saying, hey, is it time to think about, rolling something back? Or is it, again, what ideas can we take from other states that would even be more targeted? Or what are the ideas that people could do at the city level as opposed to a statewide? Because we want to stay away, if we can. I don't think there's any data that says that the whole state should be moving one way or another, because as we're seeing where these cases are, and again, even within that, you don't want to, I'm going to say penalize, but you don't want to penalize an entire county because case counts went up because of a couple of parties. Or a wedding party or a funeral or whatever it is. I mean, it's like, wow, now we got to shut everything down because of that. So this is again where we'd like to have the individual collective responsibility take hold, but there have been other places in other states where through, let's say, the liquor control boards, if you see a guideline that says, hey, you should be practicing social distancing, and you've got, every Thursday, Friday, Saturday, you got a jam-packed college bar. Other states, they've come in, not the governor, but they've come in at the local level and said, hey, look, you're not following the guidelines. We're shutting you down for a week, or till you clean out your do disinfecting, or they can do something with their liquor license. Other states have said they're shutting people down at 11 o'clock because apparently there's some states thought that by going to the full closing hour that there was social distancing degraded as you got further into the evening. People were doing less dining and more drinking, and so between 11 and 1 or 11 and 2 was when more transmissible moments were happening. We're looking at all that stuff, but those would all be local decisions if people want to do that. But statewide, we still feel like we're positioned for success, but we've got some trend lines that we'd like to be going more like they were in June than they have been in July. We're going to jump to the back row. Jacob and then Dave.
Going off of those trend lines, New York listed North Dakota as a must quarantine state after visiting North Dakota. There aren't any travel advisories for our state necessarily. Do you think it's safer coming into North Dakota than it is leaving?
Well, I'm not sure exactly. I mean, I understand what New York is doing. Their numbers are coming down, which is great for New York, and I'm sure they want to be cautious after everything they've been through. When other states were putting the travel restrictions on people coming from New York, that's when their rates were like 45%, in the 40s, et cetera. I mean, North Dakota, like we talked about, with our weekly rate, below 3%. Our last 2 days, which is trending up, is a 3% rate. It is again, what they're using is I think that New York was using the COVID tracking project data as reported on the Johns Hopkins website, which when you exclude all the serial testing we're doing, which any epidemiology would say that's exactly what you have to do for a disease that is asymptomatic. Whether you're a healthcare worker or whether you're a college student, we've got healthcare workers that have been asymptomatic, but they turn out to be positive. Like I said, this is not like the flu. The flu, who's sick. If you're sick, you're like, hey, I feel horrible, I'm going to stay home. You can be like, I feel great, I'm going out to the bar, and then you infect a bunch of people. So I think that the data they're using with a trigger was that if you're above 5%, well, if you exclude the enormous amount of completely appropriate and absolutely necessary serial testing we're doing, then you can come up with a number that we're above 5%, and then we'd be on the travel advisory. But the idea that a state with 3%, where we've been one of the lowest from all along, is on a travel advisory. I mean, again, I think that's a data issue. But I respect that every state, I respect states' rights. I respect that states can decide who they want to have a travel or not. We put travel advisories on from other states if people want to put them on from us. I respect the governors and decision makers. If they're doing it that's triggering off of bad data, then they probably should look at it. I believe Minnesota came off that list travel advisory, but if you've read about, Minnesota's going through a massive systems change, and Minnesota's number of reported actives have just collapsed in the last 5 days that they're reporting, and I'm guessing in the days ahead, when they restate their data, they'll be back up again because I'm sure that some of this is a system data challenge they're having, and not the fact that actual cases have plummeted to 10% of what they were a week ago. Okay, Dave?
It's the question, Governor, about the batch that you said was delayed, or there were a problem with the batch. What happened? Did they have an equipment failure? And then my follow-up to that is the lab keeping up?
The lab is keeping up, but we are. We know we've stressed the system. I mean, this was designed to do a couple hundred tests a day, and now we're doing 5,000 some days. And again, credit to the great work of the lab team, the National Guard members, all the other people that have been pulled in there, and they're literally running a 7 by 24-hour operation, 3 shifts a day. And one of the high volume machines, and we'll likely put out more information when we have more, because as I was walking down here, we didn't have the full information, but I believe it was one of the Abbott M2000 machines, one of our big ones that does batches that can be as large as 900 tests, I believe, or that's what they could cycle through in a day. They had an issue with that, and then they had to retest those, and then that pushed it past midnight, and so then you ended up with a quarter or a third of what would have been reported yesterday ended up being reported today. That's why, again, I like to think about, yesterday might have been 120 and today would have been 120, as opposed to one was 80 and one was 160. But we'll keep digging into that and get more information. I'm sure what happened is the lab team then, when that happened, worked even harder, got more people in, had to double the amount of work because they had all these new tests plus the one they had to redo. So I'm sure there was heroics involved in getting them into the next day's work. So again, credit to them, but it threw off our daily reporting a little bit. And if you go back, all the way back and to the beginning of this thing, and you take a look at every daily report we have, then you look at, that was a record, back in May, that was a record. You remember that one? That was the one back in May where we had a breakdown and then retest and all got lumped into one day. So if you look at over the whole course of 4 months in data, we've got a couple other times where this rolling past midnight thing has occurred, where we've overstated a single day and understated the prior days. And that's going to happen. One of the things that when we think about with the universities coming back in, we want to get more testing done, in Fargo and in Grand Forks, where 2/3 of our university students are, and we want to get the universities themselves involved from a university lab standpoint, because we put a lot of pressure on a single lab and then single machines within that lab, where we've got when you're running this hot, sort of redlining every day, you don't have much room when you've got equipment failure. But that's what you do during emergencies. You run full speed ahead. We don't have an option to sort of have spare machines sitting around. So we're going to have these, but again, teams working through it. I'm going to go back to Lane and online too, and then we'll swing back to the left side.
Governor, in reference to K through 12 schools, has your office thought about maybe changing reporting the positive cases to city by city to help those individual school districts determine whether or not they can continue with in-person or switch to distance learning?
Well, I'll just take that as a suggestion we'll take under consideration, because I know that some more populous states, reported by zip code. We stayed away from that because we were reporting, age and age and gender and county on when we were doing the death reporting. We were, trying to find that balance back when we only had 1 or 2 cases in an entire county. If we gave the zip code, it would have been almost like a personal, ID identifier. But I'm going to just put a challenge out to our own team as I'm thinking about this. I saw the map the other day of if you overlay our school districts with our counties, with our public health districts, it looks like 3 different jigsaw puzzles. They don't all match up. And so for a school district, a large rural North Dakota school district may be touching multiple counties and multiple public health units. We looked at that intensely last week before we did the announcements, but we may want to think about aggregating, could we aggregate the data for a school board that would tell them how many positives are in their school district and just share that? Maybe that's something we could do. So that's a challenge. We'll take that challenge.
follow-up to that. Has it been decided who reports positives to schools yet? If that's up to the state or a medical provider or a family?
I don't know the answer to that one. That's another one, but good question, and we'll have an answer before school starts.
Radio group on reporting serial testing versus unique individuals. Why aren't we breaking those numbers out, reporting how many tests come from serial tests and also how many tests come from the unique individuals?
Well, we do break out the number of serial tests, and we do break out the number of unique individuals because we want to do the reporting to match the national. And then we report one number, which is the number of daily positives. We're going to take a look at whether or not breaking that out would help quell these questions. It doesn't help us at all from a policy-making decision because we want to know of the tests that we took on a certain day, how many of those people were positive, because that's who we know who we need to isolate and who we need to work with. I think the So I mean, I know that people are curious about this question, but I would want people to think about it. It doesn't matter if a person was tested before and now we test them again and they're positive. We do the same thing. I mean, we identify who their contacts are, we work to isolate them, and we drive it. So there would be no change. It's not like if you think about someone driving the car, you could add another gauge on the dashboard, but if it didn't change anything you did in terms of how fast you drove or where you drove, then it may not be a useful gauge. And so, but there's some people that are interested in all kinds of data. So this is one that could be one of those nice to know things, but it's not changing. It's not changing how we think about the point prevalence rate, which is what we're trying to figure out. And we have to include the serial testing in the denominator to get that, if that is helpful.
And then Scott Hennon with WZFG and KFYR Radio. We continue to hear from North Dakota businesses that say despite the low risk of infection, customers aren't coming back. What can you do and what can businesses do to get business back until the pandemic is behind us?
Well, I think, Scott, for that question, it really is about consumer confidence. And I'd say there are, some customers, that I say may not be coming back. I mean, if somebody's over 65 with underlying health conditions and used to go out to dinner 4 nights a week, they're probably not going out to dinner. And they're definitely going to not go out to dinner if they go to some place and they get there and they see it's super crowded, they can't socially distance, and nobody on the staff is wearing a mask. I mean, that would be, they might get to the door and say, hey, I don't feel comfortable going in this location. So it depends a little bit on you serve. If your customers are 21 to 24-year-old college crowd, they probably have a lot of confidence because they have less risk. So it depends a little bit on that. So, and then again, when we say coming back, we know that during this pandemic, particularly if you're in the bar and restaurant business, you got to think about your business model. Some people have shifted their business model to doing more takeout and have expanded their customer base. And people are very comfortable ordering takeout from them where they may not be comfortable coming in and actually sitting down. So I'd say it's like every business, you got to understand who's your customer, who's your competition, how do you deliver more value to those customers than your competition does. And in this case, part of the value equation isn't just the price of the food or the drink, it's not the quality of the food or the drink, it's whether that person feels safe. And I'd go back to the economic resiliency grants. The economic resiliency grants are specifically designed to help people rebuild consumer confidence. So if I would say, if you're one of those businesses that's been struggling with customer account, absolutely apply for an ERG grant and do things that will make customers feel more comfortable, and then earn those customers back, and then communicate with your customers about what you're doing to make sure that they are safe when they're there. I'm going to go back row, and then, so I'll go the reverse order. So, Dave, are you comfortable going first? Okay.
I'd like to ask the Chancellor something.
Okay, thank you, Dave. Chancellor Hagerott. And then can we dial up Josh Wynne, too, in case you get him on the screen?
Has to do with residence halls. I know that UND was considering going from 2 per room to 1 per room and 2 per suite. Is that going to be common across all 11 campuses when it comes to residence halls?
So that's why we're having each campus look at the density. One benefit of having the online options, the hybrid flex, is that students don't have to congregate for the classes, but when it comes to living arrangements, they come here. Well, now you've got to live somewhere. So we've got some campuses with excess capacity, others are tighter. So I don't make a general statement, but where we can, we're trying to accommodate the desires of the students. But I'm not trying to dodge your question, but it's being worked out on each campus.
It's a campus by campus decision.
Correct. Right.
Question to follow up on that, Mr. Hagerott. Obviously, students, they will go home from time to time during the semester. What does the testing protocol look like for students who go home in a different state for a few weeks and then come back to campus in October?
No, you make a great point. How much testing can you do blanketing? And so the strategy is unfolding, and it has been approved. And again, I want to thank Vern Dosh and the Department of Health that's thinking through this, is we're going to try to test as many as possible on the initial arrival, trying to knock things down and then ask them to, obviously, the positive test to then self-quarantine. But it's not practically testing, 45,000 students every couple days as they move around. We'll ask them to, be careful in the judgments they make. Like there's some evidence down in Florida, they're having parties funded by gangs to get people together. They're being used as vectors. That our students would be, smart about this and try to reduce their exposure. And we would do basically, surveillance testing to just see, what the level is going on in general. But I don't anticipate in any of the draft plans I've seen that, if you drive back to Center, North Dakota, that you got to get tested when you come back. Again, I think the logistics would be just too much. It's a cost-benefit payoff. How much can you test? And we're mindful that the governor's testing capacity has to take care of the rest of the state too. So, yep.
What would be the policy for masks this fall, Chancellor, on campuses?
So the policy for masks, that's what the state board is taking up tomorrow. The president's just reviewed that. I'm inclined to think it's going to be fairly forward-leaning, but you'll have to tune in tomorrow's special board meeting on that topic because we're mindful, much like the governor pointed out, sometimes peer pressure can be a little confused. We're trying to have positive energy, again, what was suggested, the COVID conquest, the more masks you have, the more social distancing, make it a competition that the students want to be positive about rather than negative. But I think the board does want to express a view of that. And each campus, whatever comes out, I think will be responsible to implement, in their unique context.
I'm wondering if there's a possibility that the state's institution of higher education will have to pivot back towards online learning of some sort in the event that there's widespread, community spread in campuses. What is the thinking behind starting classes in person for most students?
Well, first off, we are a low-density state, and I've been on many conference calls where basically I've heard later that if they could just try to de-densify, their urban campuses, but you can't have your cake and eat it too, right? They're in the middle of these mega cities. They've got thousands and thousands of tourists walking onto the campuses. So we already have that benefit. And we do know that from a mental health standpoint, it's helpful that students can interact and be together, so that's a positive. But also a lot of things require students to be in unique labs. You can think of, the welding labs and other things. And we've taken measures in the spring to finish out those classes. So there is a benefit of being on the campus, and we want to do that. But as you point out, we effectively showed we could pivot. And again, with the money that we were given through the federal government, thanks for the correction on that, we're rigging the classes. So in many ways, it'll look seamless if they've got to start taking the classes synchronously. But maybe it'll be down to, we'll just ratchet it down perhaps, that, we're going to de-densify the classrooms from 40% to 30 to 10. So there's still 4 students in the class with the professor, but the rest are back, watching from their dorm rooms. So we want to have adaptive strategies just like you would in a campaign plan, in a war.
I do have one sort of related follow-up, and I haven't listened to all the conference calls that I'm sure you're on every day, but forgive me if you've mentioned this. I'm wondering if there will be an opt-out for students who don't necessarily feel comfortable coming to class in person. Will they be able to take classes online?
That's why we're spending the federal money to rig these classes so that if you've got asthma or a pre-existing condition, I mean, this could be a real breakthrough, which I know the governor's talked about this for years, that the distance shrinks, as much as possible, that people could be taking a class in the dorm room, they could go back home if they got to help take care of an elderly grandparent, and they can still be living that experience as much real time as possible. And that comes into a benefit of North Dakota. We're one of the most wired states in the country, and I know there's still some bottlenecks at different rural places. But I feel very optimistic about our system across the level, and we know, like in a campaign, there will be people who get sick. There will be faculty members who get sick, but also we have the provision that a faculty member needs to be able to teach these things remotely. That's possible too with technology. So we're really fortunate that this pandemic is coming in 2020 and not 1999, with globalization, but without the technology to do what we're doing.
I would give Dr. Wynne an opportunity to, if you heard all those questions, anything you'd like to add on reopening, Dr. Wynne? And thank you for leading the task force.
Yes, Governor, pleasure. No, I don't think there's anything that I would add. What we're trying to do, again, is to balance what the clear student desire is along with their safety. And I think we have a reasonable plan. But as the governor said, we will continue to monitor the situation and adjust accordingly. I like the word pivot. That is something that an individual campus may need to do in the future. The important thing is to keep our guard up and be aware of what's going on in the multiple ways that the governor and the chancellor outlined.
And I just make a broad statement. Again, I'm grateful for the leadership of Chancellor Hagerott and Dr. Wynne on this. But what we talked about with K-12 last week, and there, good questions coming up here today from the press corps about sort of the what ifs. These guys have already covered hundreds and hundreds of what ifs, and there's going to be thousands more. So this is going to be a on the ground game, and we'd like to, again, in North Dakota, whether it's when we think about businesses or cities or state government or K-12 or higher ed, rather than this spring when we were turning the light switch off and closing everything down, when we come into it this year, we'd like to, if you could shut down a classroom instead of a building on a campus, that would be better. It'd be better to shut down a building than a whole campus. It'd be better to shut down a campus than the whole higher ed system. And so again, being targeted in terms of our response, but the way we're able to do that is with early detection, with surveillance testing, with all the things that we're working on together with the Department of Health and the health strategy team. Because if you're fighting something that may really be invisible on a campus, because younger people are more likely to be asymptomatic, you could end up where you could have an overwhelming number of cases before you even know you're in a position if you didn't do testing. So the test, trace, isolate, the basic blocking and tackling is still going to be really key to our success here. Okay, we have questions online, then we'll back to Jacob.
April Baumgarten with the Forum of Fargo-Moorhead. The rock band Great White had a concert in Dickinson with no mask or social distancing a couple weeks ago. Have there been any outbreaks or cases associated with that event? And do you think we should implement restrictions or requirements for concerts and concert goers?
I can check on that. I have not seen or heard that there was any contact tracing related to that. I did see an article that the Great White had apologized for that. I believe it was part of the an outdoor event downtown on a street event. And again, we always prefer outdoor versus indoor. Apparently, again, the studies would show that virus travels less well when you're outdoors. I've been to one of those street events before, and there was I'm sure there was a way to attend and social distance because they open up like 4 blocks, but I imagine there was people there that weren't social distancing, but I haven't seen the data from that one yet. But again, encouraging when people are doing outdoor events, great. Just make sure we keep a distance, and nice of the band to apologize. I was just thinking to myself that knowing my own singing career, I'd probably sound better with a mask on than without a mask. I don't have that melodic voice that Dave Thompson does. But do we have another one here from online?
Renee Jean with the Williston Herald. The first death in the West was a woman whose family members say she caught COVID-19 while in a Bismarck hospital. The family also says that the healthcare workers seemed worn out and very stressed. Is there any thought that perhaps the reopening should slow down at this point before the system and our healthcare workers become overwhelmed?
Well, listen, again, I've got deep empathy for anybody who's lost someone during this time frame, and I can't, comment on the specifics around that or the stress levels of healthcare workers. We do know that when you're in a pandemic and you're on the front lines, there is stress. We do know that we've got a great healthcare system in North Dakota, and we also know that during this time period, depending on the time frame of when this loss happened for this family, we've actually had hospital organizations that were furloughing people because we had a decrease in demand. And so we're starting to see, from the call this morning, we're starting to see the level of rate of hospital visits, whether it's for stroke or cancer or heart, starting to come back up again. But we are not operating at the level of healthcare delivery that we were pre-pandemic. So I don't think the system is stressed from the standpoint that we've overloaded the system. We're actually operating below what our prior capacity was, and so I don't think that's an issue. But any individual worker, working long shifts, it's hard being on the front lines with this. And of course, again, our condolences to the family. These last two, and then we're done. So Jacob, then Jack, and then we'll see you next week.
Governor, if the plan is to have students tested days before they come onto campus, that's going to put a lot of stress on the testing infrastructure. How confident are you that we can get these results in time for their school year if they're given that week to conduct them all?
Well, this would be a better question probably for Dr. Wynne, and I don't know if he's still with us or not, Dr. Wynne, but I know that there's some discussion about the big surge of everybody coming back in the fall from other states. Is that the thought, I know they were discussing in a call I was on last Friday, that if they're coming from out of state, that they might be asked to get tested before they come here. And Dr. Wynne, maybe you want to expand on that if that's still part of the thinking.
Yeah, sure, Governor. One of the things that the Department of Health should be releasing very soon is a very robust schedule of testing, so that the very thing that you raise will be able to be addressed. That we're going to try to coordinate when students are planning to be on campus with the testing, so that turnaround will be timely, that the system will not be overwhelmed, and that we can have as safe a campus as possible. So these multiple testing sites on multiple dates should obviate sort of the rush that might otherwise overwhelm the system. And you should, and the rest of the state should see that schedule in the very near future as soon as it's finalized.
Final question goes to Jack.
Off the beaten path from today, but just wondering if you could provide an update on serology testing?
I can't, but we will next week on that. So, okay, we're adding serology testing to the next week. Okay, well, thank you all, and thank you guys for thanks for being here, and thanks for everybody that stayed through all the Q&A. Again, North Dakota, let's continue to be North Dakota smart, keeping our distance, washing your hands, wearing a mask when appropriate, when you can't physically distance, and let's help slow the spread and protect both lives and livelihoods. Thank you very much. Have a great day. Be safe.